For this embodiment section, you will need a chair that is slightly firm, so nothing too soft and cushiony, but also nothing that's super firm and rigid. If that's all you have, let's say like a wooden kitchen chair, you can take a little blanket or a towel and just place it on the seat underneath of you to soften it a little bit. You'll also need about a 2.5-inch diameter ball. So this is a yoga tune-up ball. The one that come in a pack of 2 that are slightly firm. You can also use a squash ball. If you're really in a pinch, you can use a tennis ball, although sometimes I find that's a little bit too big. You can also use a golf ball in a pinch. However, you want to make sure then that you have a hand towel that you can place between you and the ball, because it is quite firm. And so what we're going to focus on in this segment is learning how to relax the pelvic floor, which is very important in preparation for birth. And what I find is as pregnancy progresses, the pelvis gets a little bit wider. And so then the pelvic floor that attaches to the bones of the pelvis tend to get a little bit lengthened. So if my arms here are the pelvic ring of the bones, and then the muscles would attach on through here, as the pelvis widens, the muscles get stretched, and so they lose their inherent strength. And also to hold up that increasing baby weight, they tend to get tighter and pull in to connect. And so in preparation for birth and to increase the flexibility, adaptability of the pelvic floor to allow baby out, and also to limit tearing or the need for an episiotomy, I find that super important to teach the pelvic floor how to relax and lengthen, and this is a really good way to do that. So similarly to connecting to the pelvic floor and Kegling on the exhale, we can use the inhale to lengthen and relax the pelvic floor. And that's what we'll do right now. So just sitting on your chair or your bench, wherever you are, see if you can tune into your seat again. What's happening to the sits bones right and left? What's happening to the pubic bone, tailbone, front and back? How is the hammock of the perineum and the pelvic floor contacting the chair? And let's take a few nice breaths in. So breathe into your ribcage again. And notice pelvic floor descending just a little bit. Exhale, let it go. Inhale again. And exhale, soften. So just that awareness. Again, no judgment, no need to make it any different. Just that proprioceptive sensation. So to release the pelvic floor from the outside, we're going to use the tune-up ball. And where you're going to place the ball is under your seat, just inside the bony part of the sits bone. So sits bone, the balls can go right in through here. And we're focused a little bit more on the posterior fibers of the layer 3 muscles in order to relax and lengthen them, give them a little bit more adaptability to work well to support you, but also to lengthen in preparation for birth. So I'm going to place the ball under my seat. I'm just going to show you the back part of my pelvis here. So the crease of the glutes is here, and we're going to place the ball just inside the bony part of the bum. So my sits bone, the ischial tuberosity lays right here, and you're going to place the bum just inside there. You want to make sure it's a little bit further back than forwards. If you place it in and you feel like it's on bone, you need to move it forwards, backwards a little bit more, okay? It's a little bit further back than most people expect. So once you wiggle to find that spot, so sits bone, and the ball's right snug up inside of it. It's not too far forward, so you don't want to be on the labia, you want to be behind the labia. Once you find that spot, it can be a little bit tender, it can be a little uncomfortable. That's fine, that sort of indicates that there's some tension there that needs to be released, and that's what our focus is for this segment, so that's good. You want to make sure that the discomfort in the pelvic floor, or if there is pain, that it isn't more than a 4 on 10. After that point, we tend to subconsciously guard and protect, and there's no benefit of pushing through the pain, even though you can persist through it. So if there is some pain that's more than a 4, I'm going to get you to lean over to the opposite side that the ball is on. So we're on the right side right now. Get you to lean over to the left, just to offload it so that you can tolerate it a little bit better. You're going to sit on the ball for about a minute, up to 3 if it feels good and it's doing some good work. And as you sit on the ball, I'll get you to use your in-breath. So inhale to those ribs again. Imagine the pelvic floor lengthening side to side, front to back. On the exhale, you just see if you can let yourself soften a little bit more. Inhale, create space in the pelvis. And exhale, try to keep that space. You can also imagine as you breathe in, the soft tissue of the pelvic floor melting like butter or spreading like taffy, allowing the tissues to lengthen and expand. You will never overstretch your pelvic floor. It has 5 major functions and it is always working, especially during pregnancy. So be here for a few more breaths. I would not recommend doing Kegels in this position on the ball. It's going to feel very uncomfortable. You mostly want to focus on relaxing, lengthening, releasing. The more you do this, the less uncomfortable it will be over time. You may notice a shift that if you do this starting your 2nd trimester, it's not too uncomfortable, but there's some release that you get, which is great. As you get into your 3rd trimester, and maybe halfway through that 3rd trimester, you might notice that the pain diminishes when you go to sit on the ball, and then after maybe a big baby growth spurt or position change, there may be more discomfort in the pelvic floor, and that's normal. So it just means that you might want to do it a little bit more often around that time in preparation for your birth. You want to make sure though that you are giving yourself at least 1 day of rest between releases. If you have any swelling in the perineum and the labia or any vulvar varicosities, I would not recommend doing this for you. It will be very uncomfortable and maybe quite irritating to the inflammation. Instead, what you can do is focus on your breath and relaxation poses where you are in a little bit more of a stretch position. So a supported squat pose, a puppy pose, maybe happy baby pose where you can imagine that lengthening of the pelvic floor without actually putting a ball there, okay? So we'll take the ball out of that right side and I'll get you to sit without a ball for now. And then just find your seat where you were before, no ball. And just again in your mind's eye, bring your awareness down to your pelvis and see if you feel any differences compared to when we started. So as you breathe in, to your pelvis and your belly and your ribs, how does that affect the pressure and the descent of the pelvic floor and the pressure in the perineum onto the chair? And on the exhale, what does that do? So I feel with this, my right sits bones is way further away from center than it was when I first started. So I definitely feel like my left sits bone is closer to the middle and I feel way more grounded on my right side. So we're going to take the ball and place it under that left posterior pelvic floor, just inside to the sits bone and the ischial tuberosity. And it may feel different side to side, and that's fine. Just again, being aware that you don't want to be more than a 4 on 10 pain-wise, and that if it is, you offload it, and that you really try to soften and melt into it. It could be even less than a 4, but if you feel like you're gripping and you can't soften into it, then offload it still. So breathe into your ribs. Imagine your pelvic floor lengthening. Imagine your sits bones gently drifting apart side to side. Imagine your pubic bone tailbone gently spacing apart front to back. So you can imagine that your sits bones, pubic bone, tailbone are like magnets of opposite poles and they're repelling each other front to back and side to side. Again, using your in-breath to imagine that lengthening, creating space of the pelvic floor. Let the fibers of the muscular tissue soften and melt. Let them lengthen and expand ever so gently. And if you have started offloaded to one side, as the discomfort diminishes, you can slowly start to put more pressure towards center. So once you're done that minute, you can take the ball out. And if you want to stay there a little bit longer, my left side is tighter than my right for whatever reason. And so I would probably decide to stay there a little bit longer, but for the interest of time, when you're done releasing that side, you'll find your seat again, tune into your seat. What are your sits bones doing? What is your pubic bone tailbone doing? What is your perineum and pelvic floor doing as you inhale? Is it expanding a little bit more symmetrically, a little bit more fully? On the exhale, does it recoil a little bit more? So again, you can do this one at the most every second day. And I would say starting this as early as you can in your pregnancy, the better, even if you're not having any discomfort this time. So if you're asymptomatic, I would say maybe start doing it once a week to twice a week. And then as maybe you hit your second trimester, you tune in and see as the tension increases, then maybe you need to do it more often, up to 3 times a week. So we're going to come back down onto the floor. And you'll find your supported position as far as on your back with your knees bent, feet flat on the floor. I'm going to stay seated just so I can remind you of the Kegels and reverse Kegels. So making sure that if, again, you need to be propped up, so a little bit more semi-reclined, or if you have that little towel or blanket under that right hip to help offset any sympathetic responses that you might get as far as dizziness, sweating, heaviness, shortness of breath, reflux, and then that's great. And here we're going to coordinate now the pelvic floor activation with the relaxation, or the Kegel or reverse Kegel as we call them. So as a reminder, to coordinate the pelvic floor activation and relaxation, we need to work with the breath. So on the inhale, we'll think about relaxing, lengthening pelvic floor. So sits bones go wide, pubic bone, tailbone goes wide, front to back. On the exhale, we'll do a Kegel. So whatever version of that is for you. So we can focus on the layer 2. So we think about closing front to back or winking the clitoris down. Add on sensation of stopping pee and then drawing sits bones together. Or you can think about the layer 2 muscles and gently drawing tailbone towards pubic bone, or closing the pelvis back towards the front without moving the pelvis. Again, this one will feel more posterior, but that's fine. It's important to do both during this time. Finding your nice, comfortable, reclined and supported position, knees bent, feet flat on the floor. We'll focus on that posterior lateral costal expansion breath, so the 360 breath, breathe into the ribs. Imagine pelvic floor lengthening right to left, front to back. Inhale. On the exhale, think about flickering a flame of a candle. Connect pelvic floor. Inhale. See if you can feel that tension in the pelvic floor let go as you breathe in. So breathe in. Imagine the tailbone is heavy. Let it sink down towards the floor. On the exhale, gather everything up and in. You can imagine drawing tailbone towards pubic bone. Don't move the pelvis. Don't grip with the bum or the belly. Inhale. Imagine the sits bones gently driven apart, side to side. Reverse Kegel. On the exhale, close the pelvis front to back. Stop pee, sits bones come together, layer 2. We'll do 2 more. Breath in, tailbone's heavy, pubic bone is light, let the pubic bone float up towards the ceiling. Exhale, reverse it, draw pubic bone towards tailbone. Stop pee, sits bones come together, and then see if you can tuck the tail towards the pubic bone. So you're doing layer 2, layer 3. 1 more, inhale, let that all go. Tailbone's heavy, pubic bone is light, sits bones go wide, reverse Kegel, in breath, lengthen. Exhale, close front back, wink the clitoris. Stop pee, sits bones together. Draw the tailbone towards the pubic bone. Hold for the duration of your exhale. So the important part here is trying to feel the opposition of the activation and tensioning as you exhale and connect to pelvic floor, and then that relaxation, letting go of the reverse Kegel as you inhale. So exhale, gathering up an intention. Inhale, let all that tension fall away. So I'd recommend you to do this Kegel, reverse Kegel combination for probably about 15 to 20 breaths, 2 reps. Easiest to do laying down. You can try it seated or standing, but that's going to be much harder because you are going to be in gravity. And again, this exercise is more for a sense of coordination, more of a sense for dropping the pelvic floor and letting it lengthen. And sometimes we can only really do that well if we feel that opposite activation and tension. So if you know your pelvic floor is tight and you don't want to do too many Kegels, I recommend that you do about a 50% maximum effort Kegel, so maybe just halfway on, just so you feel this little tension of the pelvic floor on the out breath. If you're in your 3rd trimester, I would do the same recommendation of focusing on that 50% Kegel. and then focus more on that full drop and making sure that on the drop, you're not pushing or bearing down, that you really are drawing your full breath in to lengthen and expand.